we looked to doing some pet therapy.
Yes.
Because having worked in the NHS and benefited from the NHS, we felt we wanted to give something back.
Oh, that's good.
I wasn't sure, but I have to say he has been lovely.
Yes.
We were invited to the dementia unit, and the staff there have been fantastic.
Oh, that's lovely.
He doesn't discriminate between levels of staff.
Spreads the love around.
He spreads the love around. Doctors, nurses, hotel services,
Yes.
all have to say hello to him.
Everybody gets a
And
welcome.
they all have a little bit of fuss. Patience.
Yes.
He's very, very sensitive to their needs.
Oh, that's nice.
And if they become distressed, he will sit quietly with his head on their laps.
Oh.
I'd never been on Twitter, but the staff have taken pictures, and I've been so impressed.
That's what they share,
with
don't
with
they?
how he is with them.
Oh,
Because I don't think you see it yourself.
Yes.
Been interesting that I wasn't sure whether we did actually make a difference, because a lot of the people are so pleased to see him.
Yes.
Some of them get a bit emotional. They talk about their own dogs that they've had in the past.
Yes.
And they can go back years telling me
Yes.
about the names
Oh, yes.
of the dogs and what they did and what they didn't do. And others tell me that they've had to have their dogs put to sleep because of their illness.
Yes.
But I've been aware that there's been a patient who, a little bit reclusive, patient sits quietly on their own,
Right.
doesn't interact with staff, doesn't interact with other patients. You don't see them reading, watching television. They're just almost just sat there, expressionless, really.
Oh, right.
Had not wanted to know anything about Ianto, which
It's fine.
is fine.
Yes.
It's fine. But a week or so ago, the patient, just out of the blue, asked the age of the dog.
Yeah.
And so the nurse with me told the patient the age. And then this week, out of the blue, the patient asked if they could stroke.
Oh, wow.
Well,
And
the
engaged,
staff
that's lovely.
and was so excited by this.
Yes.
And
Small
Ianto
little
went,
breakthrough then,
yes,
isn't it?
yeah, a little small step, but the patient stroked him, and Ianto sat quietly,
Oh.
and it was just so lovely
It's
to
a-
see.
Quite a powerful little moment there, isn't it?
And I think it made me feel that we had made a difference.
Definitely.
I don't know whether next week the patient will want to stroke him, but that opportunity will be there. I had been aware of the patient following
The
with
walk
eyes,
around.
yes, yeah, but not saying anything. So it was lovely.
It's nice.
And the staff were going to ring the family
And just let them know.
to let them know
Oh, that's
about this
little breakthrough.
interaction
Yes.
between the dog and the patient.
Oh, that's just lovely. Nice little story, that, isn't
Yes, yes. It's sometimes things just stick in your mind.
it? Yes.
We've been very fortunate then too that we've been invited to visit a more acute medical ward, and we also go to a stroke unit. Obviously every patient is different, their degree of disability is different.
Yes.
We're accompanied at all times by a member of staff,
Mm-hmm.
and they make sure that the patient wants to see the dog. And they bend over backwards to move chairs, tables, the bed gets up, the bed gets down, so that they can actually touch.
Yes.
And even if they can't see or speak, they can feel.
Yes.
And you get this tiny little smile.
Oh, that's
And,
lovely.
and it does, it's a little bit of a tearjerker really, and a
Yes.
bit of a soft touch.
So,
And just that he can bring that out in
Yes.
people.